I am Dr. Vivek Vij, Director for Liver Transplant and Hepatobiliary Services at Fortis Group of Hospitals. Today I am going to tell you something about life after liver transplant. What do we expect after liver transplant? All over the world, liver transplant has become a very successful treatment. We can expect that we will be able to discharge at least 95% to 96% of patients from the hospital after liver transplant, indirectly meaning that the risk of life of after liver transplant is 3 to 4% immediately. Now, out of the 100 patients which we operate, we expect at least 65 to 70% of the patients being hale and hearty at the end of 15 to 20 years. So, it is a long time, it is a very successful treatment. So, we can expect a very long term survival for a patient who undergoes liver transplant. Now, after liver transplant, although life becomes much better than pre-transplant period, but there are certain set of precautions which patient has to take after liver transplant. And these precautions are similar to the kidney transplant patient or bone marrow transplant patient. The first period or first 6 months are very critical for the patient, in which the body is adjusting to the new liver and liver is adjusting to the new body. Now, and the drugs are at maximum dose. The patient is at risk of rejection and risk of infection. So, during this initial 6 months, the precautions are much more valid or much more, the patient has to be aware of all the precautions which have to be taken after transplant. Most important thing after transplant is remaining in touch with your primary physician or a surgeon, because until and unless you come regularly for follow up, the surgeon or physicians cannot detect any problem which becomes later on untreatable. Second precaution is you have to stick to the medicines. The medicines which are taken after transplant are mainly immunosuppressive medicines which decrease your body immunity and prevent the liver rejection. If the patient doesn't take or doesn't stick to the medicines or the timings of medicines, then liver can reject after in the post transplant period. So, this becomes very important when the patient is traveling outside. Usually the patients forget their medicines at home, so they have to make sure whenever they travel they have enough medicines for that period of time. Next precaution which I want my patients to take is that they should develop habits of eating clean food, home food, and they should frequently wash their hands whenever feasible. Direct exposure to sunlight should be avoided. Patients should wear long sleeve shirts and pants, basically for two reasons. Number one, UV rays in the sun, they attack our skin, especially after transplant, and chances of skin cancers are higher. And secondly, certain vector borne infections like mosquito bites, like malaria, dengue are very common. So, long sleeve shirts and pants would avoid that mosquito borne infections. In initial 1 year, I usually advise my female patients or women's not to have pregnancy in the first year, because it is the time, as I have already told you, that body is adjusting to liver and liver is adjusting to body. We are manipulating the drugs, doses and everything. So, pregnancy or childbearing is advised only after 1 year of liver transplantation.